Hi everyone, my name is Simone Morse. I'm 29 years old. I'm from Germany originally, but living in Brussels, Belgium at the moment. I studied European Public Health at Maastricht University in the Netherlands and following with a master's in International Health at Uppsala University in Sweden. Thank you for that. While studying international health in Uppsala, Sweden, I founded, together with other students from Sweden, the Swedish Network for International Health. It's basically a student network connecting students from all over Sweden who are studying in health-related subjects such as international health, global health, health informatics, economics, so all over the map, but all with a focus on health. And one day, Camilla, who we all know now from the previous videos, she actually contacted us and reached out, asking to collaborate on something. I don't even remember what it was. I think it was a mentorship program or just a regular initiative, and that was about in 2014, 2015, around that time. So then we together launched a Global Health Mentorships program, which most of you already know. And I was very intrigued by the network, what it did, just to getting to know more people and more international. I mean, studying international health back then, I was very intrigued by that. So I became the team's internal affairs manager, did the recruitment and the restructuring as well, a little bit of the network, and a couple of months after that, it was sort of a decision within the team that I became the new Secretary General. So I, together with Camilla, I was doing the daily management of the network with inquiring and answering all kinds of sources. Yes, so I work already, thank God. I'm a policy officer at the European Association called the European Hospital and Healthcare Employers Association, based in Brussels. And I work in the frame of the so-called European Sectoral Social Dialogue Committee for the hospital sector, responsible for industrial relations, labor market issues, and health policy, and particularly looking into the health workforce. Among others, I manage projects on social policy, but also on health policy, of course, and the current one being to strengthen the social dialogue on the East, Central, and Western Europe. But I also do legislative analysis that have an impact on the health workforce and on the labor market. So it's a bit, it's a mixture of both. It's basically my health, what I really strive for and what I really love. It's the health policy aspect, because you can shape so many aspects of our life in the health sector by policy, but also on the social field, because it's a lot of with working conditions. We all now know that the latest developments on the health front really has an impact on the health and the social policy. So with, as I said, working conditions, pay, stress at the workplace, psychosocial stress and risk at work, multiskeletal disorders. So these are the elements that I work in right now, since this job I have since 2017. Of course. So my career path is academic public health. I would classify it as such. You might say I'm a bit of a health geek, and through and through. So from day one, I was really much health interested. And it all began in high school at the age around 15 and 16, when I had to decide on where I want to finish my high school degree. It's a German Abitur, it's called. And there was a school in my area which really has a focus on health. So you would graduate your high school with a specialization in health. You also had psychology and pedagogics, but that was not for me. And I was really hooked by it, because one of the classes that we had was on public health and epidemiology, and I was really interested to really how do I shape the health behavior of a population by providing certain infrastructure, by ensuring that like free, like that you don't smoke in certain places. And this is for me the phenomenon of everything is health, and that was really really cool at that time. Thinking about, I was 16, 17, so that was really what struck me. And in the end, I got the opportunity to listen to someone who went to the Netherlands and studied their European public health, and was really intrigued by it. It was something, you were out of the country, you were supposed to speak English, so it was really something I wanted to a deep dive, and that's what I did for 3 years. And then how I went actually into global health is a bit of a different story, because when you study European public health for a while, it's always like, it seems very natural and everything is sort of good, and it's this purpley or like pink glasses, that it's not that bad, let's say, in Europe. And I felt like if I really want to know about health, I either want to go and deep dive into a specification, into really in a minor, let's say health economics or informatics or something, or I really want to go broad and broaden my horizon in let's say then global health or international health. And I felt there's more than health. Back then in European public health, there was more than just European health, and that study program couldn't teach me more. So I decided to make a sort of a reality check, I always call it, and I went on and studied European international health. So that's kind of the path. And then I went on and I worked at Uppsala University looking into antibiotic resistance research, and I did that for a while. And then I had a bit of a change of mind and I went into PR consultancy, actually. So looking into healthcare and PR, but that was nothing for me. I mean, I tried, and you have to be a consultant to be a consultant, and I'm definitely not a consultant. And for those who do that, perfect. But it was really not my thing. And then I was hooked again on trying another city out. I was for the PR, I was in Berlin, and then I found a job offer in Brussels on European health policy. So I was trying to use my knowledge within European public health with the experience I got more broadly from international and global health, and I went then on to Brussels, and I was intrigued by the city and everything. If you've ever been there, you can see what I mean. And yeah, that was 2017, and I'm still here and still working out. So yeah, that's my kind of health career path in a sense. The secret for applications, I always say when people ask me that, that doesn't come often, but when they do, I always say that you should stand out in your application and show the true you, like the real you. For example, me, I was living abroad and working in so many different areas and fields that really makes me a specific candidate. But you really have to see what makes you special, that what sets you apart from your peers. So if you, for example, volunteered and had to do a certain thing that's beside your work or beside your studies, then that shows that you have great organizational skills. Or if you had to look after a loved one or someone, and like besides your time, then that also means that you have great time management skills that some other students might not have. So this is to look really what would set you apart from the rest, what makes you special, and that's one of the things. Also, what I always like to look when I write my applications, or also when writing like kind of bullet points on my CV, is to apply this SMART method. In case you haven't heard, it's called specific, measurable, attainable, realistic, and timely, to really give snapshots of what you've done. So between the period of 2015 and 2016, I worked at the Global Health Next Generation Network, and I was able to increase the number of applications, or I was able to attain more members by 5%, 10%, etc. So this is really to make it measurable and distinctive, not be wishy-washy. Nobody is interested in this, really to be to the point. So yeah, that's sort of the applications. And what I also what I learned by myself now, also in recent years, looking for other looking where you're fit and if you are ready to go the next step. There's always I wouldn't say don't lie, but really you have to, when you read through a job application and you really think, okay, this might be me, or this could be me, or this is me, so when you read something through and you're like, nah, maybe I don't know what actually you have to write on the application, you really have to feel and you have to stand behind your application, because the application is that what you justify in the end. You justify yourself at an interview. So if you're already a little bit shaky at the beginning, don't force it. If it's you, it's perfect, and if it's not, it's fine. You don't have to fit into everything. So that's, I think, what I can give to the rest. So my ultimate goal is a very interesting wording for me, because I don't really see that they're ultimate goals. They're just a lot of smaller goals that you achieve or want to achieve at a certain time in your life with a certain position you're in at the moment. A general goal, I would say, for myself, knowing that I'm such a health geek, let's say, to contribute to a healthy and empowered society, to to take the right choices, that take the healthy choices. I'm not saying I'm eating healthy 100% of the time, that nobody wants that, but to really ensure that your overall health is always in check, and you have that in mind. And I think that's the goal right now. And my next goal and step is, of course, to advance my career and to live a happy and healthy life. I think that's all I can wish for. For me, because I'm now working in a lot of policy area and listening to a lot of scientists trying to explain their findings to policymakers or at conferences, I got really intrigued to work more on enabling researchers and scientists in communicating their findings more effectively to policymakers, because what I experience, there are probably researchers that do an perfect job in that, but generally it is more that it's overwhelming for policymakers when they've been confronted with scientific outcomes. And what I really find interesting is to enable the researchers, to give them the right communication tools and really pinpointed key 5 elements of their research and how their research will impact the policy to a better population and health. One of the examples. So in the end, you can see that if the findings are not properly communicated to decision makers most of the time, it does really overwhelm the policymakers, and the research is fantastic, but it's not really implemented as it should be or could be. So that's more on the professional side. And personally, I'm now also involved in another network called the Gentlewomen's Club, and we aim to bring together women within Brussels, but also we have different hubs around the globe, and we just lift each other up. We are there for each other, and it's not a professional network, it's a very personal network to really connect on a personal level, because in many major cities such as Brussels, there are a lot of professional networks, and it's mainly, you work from 9 to 5 or even longer, then you go to networking, reception or drinks, and then again you give out your cards and stuff, and it's not really enriching for you as a person. So we really want to bring people together that connect on a deeper level, and to bring them together from all kinds of professional backgrounds and personal history. So that can be someone who is like me, working in the European policy, but also artists and I don't know, like from people that work in the government to dancers and so it's very nice and it's very enriching, and you kind of open your eyes into different elements and fields. So that's very nice. That's what I'm doing right now. It's a really good question what global health means to me, because global health can have so many different meanings to everybody. And for me, it's really, global health is connecting people from different levels on different aspects, because global health is massive, it's huge. So you can have your own little niche, but it's always good to connect with people to bring your message forward. So bringing people together and exchange knowledge and broaden each other's horizon, that's global health for me. And we already talked that, and I think the whole concept was mentioned before in another talk probably, is that global health is all globally, etc., but really where the action is on the local level. So think global, act local. I think that's really hits the nail. Yeah. I don't know really if my current job brings much forward to the global health, but I really see it more the other way around, that my global health knowledge can bring to what I'm doing right now within the European bubble. And what I like to believe is that with my background in global health, I can now focus better on what is actually really needed and what is essential for global health, for health in general, towards the European bubble, because it's always been discussed that we should do this more and that more. But it's really, I always like to see it in the context of a broader picture, and global health, and knowing so much about global health and what really matters on a global scale is really beneficial for working where I'm right now. So that's what I can tell so far about this. You should find your niche. And I was told that you should become, or you should be, a tea person, and that's very an interesting concept, because you have to actually show it to people physically. So I'm trying to do that now. So you have to find your passion in global health and make it your standing ground. So the standing of the tea, and really, whether that be on nutrition, on antibiotic resistance, or anything that is really like your passion in global health, and that's your attitude or your identity is this certain thing. And then we have the arms of the tea, and that's like smaller passions that you're still really interested in, but it's not like your will-fulfilling kind of thing. For me, it's really looking into e-health, so electronic health, telecommunications, digitalization of the healthcare system. How can we really transform the health system with digitalization? And this will be, for example, on the tea. Like it's not like major, but it's there. And you can still focus on your main interest, but you can also provide knowledge on other subjects. And having that in mind, I'm sure that this will help you a lot when looking for jobs, that you know what you really want to look for, and this is your tea, your standing ground. Okay, this is really what I want to do. But if you see something that goes into digitalization or antibiotic resistance or nutrition or something, you feel like, oh, maybe I can look into that and really build this up. Because it's okay if your arms become your standing ground over time, or your standing ground becomes one of your tea arms. It's really to find and to settle in your role and who you are. And of course, we all know that you're evolving personally, but also professionally. So, but I think having a tea formation at the beginning of your career is very important.